I'm Dr. Vinod, and today we're going to go over the subject of the home exercise program and how relevant it is, or really is, to your recovery. So people come to physical therapy and they're told to come 2-3 times a week, sometime once a week. And every single time they come in, there's a physical therapist waving a piece of paper around or barking at them about how they got to do their home exercise program. And patients will receive the home exercise program, and sometimes they'll say, wow, I didn't understand it very well. And the physical therapist went over with me, and then he had his assistant go over with me, and we ultimately figured out that I would do it X amount of times a day, and I didn't do it. And I go back to the physical therapist, and the physical therapist tells me, you didn't do your home exercise program, and that's why you're not getting better. So my job really here is explain why. In physical therapy, what we're dealing with is the neuromusculoskeletal system in general, right? So we're looking at bones, muscles, and nerves. And anytime you get to an area that involves the nerves, you get into the area of connection to your brain, right? Because the nerves come from your spinal cord, which then attaches to your brain. So one could argue that habits that you have in physical therapy, your exercises, are connected directly to the habits you have in your brain, just as you go about eating or smoking or sleeping or different behaviors you do or the way you talk. These subjects fall into the scope of how your brain and your nervous system responds, right? So a simple example, if you're overstressed and super fearful and your mind is freaking out, you're not going to sleep, right? So the nervous system is functionally unable to calm you down. It doesn't have to do with your muscles. It doesn't have to do with your heart or something like that. It has to do with your nervous system, which is the system that drives your ability to respond to things, amongst other things, right? So when you're dealing with injuries or pain, or mostly anything that goes into physical therapy, you're going to deal with the nervous system. And when you deal with the nervous system has the amazing ability to adapt and learn and change and develop, or go the other way, not develop or degenerate. So what we don't want to do after an injury is we don't want to elicit something that goes backwards from that point. If you have an injury and your muscle strength is down by 50%, you don't want to go down to 30%. That would be regression or degeneration of the area. So when you go to physical therapy day one, after having an injury that is at 50% limited, and you work with your physical therapist, you're not going to get to 100% that day. But what you'll start to do is, through the process in the clinic, work with the therapist to adjust things, strengthen things, loosen things up, move things around, and whatever the therapy is for the day, you will adjust it to the body, so the body is learning something new. For example, if you have a patient that has pain in their shoulder and you open up all the muscles in their shoulder, you release out this area, you show them some movements to do, the muscles at that point have a new understanding of where they were from just an hour ago, for example, when it was fully in the injury area. And when you reduce all these symptoms by doing the activities you do in physical therapy, the brain is now learning something new. It's learning how it was now versus what it was 10 minutes before when the therapist put his hands on you. And that is different than what it was 3 hours ago or 3 months ago, right? So what you want to train your brain to do is understand what is a new set point for the body, right? And that's why the exercises are given to help the brain understand that, look, you've reduced pain here, or you've opened up range of motion here, or you've facilitated a muscle here. Let's continue to advance and change the way the brain and the mind thinks about the injury. So you do this exercise program when you go home as guided by your therapist consistently to continue to improve the way your nervous system adapts to the injury. And that builds on each other, right? Like anything else in the body, you can't do something just one time and be done with it, right? If you want to become better at working out, you have to do that activity more and more. If you want to lose weight, you want to do that activity more and more, meaning like you want to watch what you eat, not just one day, right? So the body is very resilient and adapts very well, but it requires some consistency. So your home exercise program is not going to be something that you do one time, and all of a sudden you experience this wonderful change that eliminates every single problem you have or the problem you're coming in with. So the home exercise program is a very, very important thing to neurologically adapt to your therapy. And if you do it the right way, it can really give you a lot of gains as you go through the therapy process. And it's one of those things you don't have to think too much about. You do your exercise program as per your therapist recommends. You do it as many times as he tells you to do it to the T. You follow it through, and maybe he advances you on the exercise program depending on what you're doing. And if he advances you, awesome. If he takes one back because it's maybe hurting you, no problem. But always continue to do exactly what the therapist says for the home exercise program. If you do it exactly that way, over time, it might be 2 weeks, 3 weeks, 8 weeks, 12, it might be even 3 months where you're continually doing it, you will do much, much better. I can't guarantee that it will be 100% better. I don't think anybody can, but it is such an instrumental part of your day-to-day activities as you recover. Recovery in the body isn't going to be a week or two process. And that's what we do. That's really what the therapist is there to do, is to move you forward so you can actually have progressive, slow, steady gain and improvement and a readjustment of the body. And the home exercise program is such a vital part of that readjustment, because when you go to therapy once or twice or 3 times a week, there's still 7 days in the week. So the other 4 or 5 days, you're doing it on your own, right? And your brain and your nervous system don't take a break. They're always on 24/7. So if you do your home exercise consistently, you're going to allow your body and your brain and your nervous system to build momentum, to readjust, to adapt, to learn, and get better over time. And that's a secret of why a home exercise program is so vital to your recovery. I'm Dr. Vinod, and thank you for listening. See you next time.